We don't know what the current health needs are in the Burm because we haven't had access to this population for 2 months. What we know is based on what we saw before and on unverified information that's come out since then. We're pretty sure there's a hepatitis outbreak. MSF saw 6 cases of jaundice when we were operational, and now we hear that there's many, many cases of jaundice, including some deaths. There's 450 pregnant women without access to healthcare, and we have had unverified reports of deaths in childbirth, which would be expected in this context. So unfortunately, the border remains completely closed and access to humanitarian aid for this population has been extremely limited. We think the number of people in the Burm is about the same. They haven't had a food distribution since the one in early August. And so we're hearing increasing reports of malnutrition. Just last week, we had unconfirmed reports of 140 cases of malnutrition just in a week in the Burm. So that problem is really becoming prominent, and the situation from that perspective is deteriorating. In terms of the weather, in the summer, we were seeing these huge temperatures up to 50 degrees, and now things are really declining in terms of temperature, and we're getting down to 0 and even to below 0. So we expect to see in the near future deaths from hypothermia in young children. Certainly that was a big problem last year. So MSF is asking for direct access to this population to provide healthcare. We hope that there will be a resumption of humanitarian aid in the near future, but it can't come soon enough.